Hi, I'm Loretta Kaes, a registered nurse who has worked in long-term care and assisted living for over 37 years. 18 of those years were spent in assisted living. I am also a board member of the New Jersey Alliance for Culture Change, focusing on person-centered care. Today's discussion is going to be about caring for one another. Staff in long-term care nursing centers and assisted living have faced many life-changing challenges during the COVID-19 pandemic. In the midst of uncertainty, chaos, and crisis, those on the front line are delivering the best care they can to the residents and patients. During my leadership training with New York nurses, specifically in assisted living, the directors of health services overwhelmingly indicated that the fear of the disease was their biggest challenge, contracting the disease themselves or bringing it home to their families. Just as important to them was the horrific experience of walking into a resident's apartment room and finding them dead, many times just having cared for them in less than an hour before. Many of their coworkers fell ill with COVID or tested positive for the virus and had to be quarantined at home, leaving many residences severely short-staffed. Some coworkers were so ill they too died. The ultimate insult of not being a priority to have adequate personal protective equipment added to the stress of working without the proper equipment to keep themselves safe. Many nurses told of expected deliveries of PPE being diverted at the last minute to acute care. Especially troublesome for nursing and rehab centers and assisted living communities was having to accept COVID-19 positive residents back from the hospital, which further caused more cases and more deaths. One Long Island assisted living nurse spoke about having to clear out the walk-in freezer in the community's kitchen and store bodies of deceased residents because hospitals were full and care there was not an option. Funeral homes were overwhelmed with the numbers of bodies and could not take the deceased residents for proper aftercare and burial. These were unprecedented times. New York was the largest pandemic epicenter in the nation, and neighboring New Jersey ran a close second. So these healthcare workers were working long hours for many days at a time, frequently without proper protective equipment and always without enough staff. In addition to that, the entire staff of each healthcare center, including housekeeping, maintenance, dietary, and direct care workers, all voiced despair about having to distance themselves from the residents, having much less contact, and then only with layers of protective garb that prevented the resident from seeing a reassuring smile and hearing muffled words of encouragement. The residents suffered isolation and loneliness, cut off from each other, staff, and most important, their loved ones. Many residents died without advance directives, leaving the staff at a loss to know what the resident wanted or expected at the end of life. Feelings of grief, helplessness, and hopelessness, and overwhelming fear caused great emotional stress to all, especially nurses, physicians, and direct caregivers. It is very important for nurse leaders to realize the emotional trauma that many suffered. It's important for them to develop a strategy to help staff recover, rebuild a cohesive team, and render compassionate care to one another. Huddles, which are short team meetings, have been shown to be very effective in increasing morale and building person-centered care. Short huddles held to give staff the opportunity to voice their feelings and have feelings acknowledged and accepted. Having resources available for grief and stress counseling for staff, residents, and residents' families. Spiritual leaders available for both staff and residents, Work well for a quick word of encouragement. Nurses are resilient and brave, but be aware they too need help and an opportunity to express their feelings and how they feel they are coping. Be ready to help, listen, and reassure. Compassionate care huddles are a judgment-free zone. Talk is positive, honest, sincere, listened to, heard, and accepted. I am sincerely grateful to the nurses in my leadership group who express their feelings and fears for themselves, their coworkers, their families, residents and residents' families. I hope it helped them. I know it helped me. As I enter the end phase of my 50-year-plus nursing career, I am confident that nurses are as strong, competent, and resilient as they need to be to face any challenge like COVID-19. My prayer is that they never again have to face this magnitude of adversity.